A couple of years ago, at the American College Health Association annual meeting, the president of the student section gave some welcoming comments, as was the custom. During that time, he was in front of 1,500 health professionals or college health professionals, and he said something to the effect that he was so nervous he could just vomit. What he expressed was a common response to being anxious. We all experience bouts of stress, anxiety, and depressed moods. This talk is going to be about mental health self-care to help you manage these everyday emotions. As mentioned, I'm James Guest. I'm the retired former medical director at Lafayette. Prior to that, I was the medical director, and a clinician at the University of Nebraska Health Center, UNL, for about 15 years. And I also have to give you a warning at the beginning, of course. I am old. I may digress into telling stories. If I do, the intent is to tell you that we all have a commonality of experience, and not to tell you that I walked to and from school uphill. But during any story that I start telling, feel free to roll your eyes and say, okay, boomer, that's okay. These are my experiences and I own them. John Della Volpe is a pollster with the Harvard School at Harvard University. He has been interviewing individuals coming out of high school and into college for 20 years. He describes or has described these individuals, well, this was not the process of what he was doing. He was looking at the outlook on the future of America and through these kids' eyes. But what he has seen is personality traits. And the trait is a generation, but not necessarily of any individual, is that the group coming into college is anxious and lonely, stressed, depressed, and exam obsessed. Because of the amount of comments about stress, I'm going to divide the talk into two parts. Your faculty has expressed a concern about the level of anxiety and stress that individuals are demonstrating and relating. And the second part, I'm going to talk about resilience, which is part and entails, along with stress, the self-care portion of mental health. This talk is not intended to talk about clinical depression, clinical anxiety, phobias, or other problems that might be overwhelming. If you are suffering from any of these, I do want to refer you to counseling services or to their website, because they have some online help as well as in-person help, and Lafayette providers can also help out with this. Well, stress. Early in our history as a species, we needed to recognize and respond rapidly to life-threatening events. This response is modulated through the adrenal cortical, pituitary adrenal cortex, as well as the sympathetic nervous system. When the threat dissipated, then another part of the brain would turn down the response. Unfortunately, as the lethal external threats have decreased, we're responding the same way as we would to a life-threatening event to daily events. Much of our stress response is dependent on how we perceive and interpret the stress. Now, a little more specifically about stress. Stress is the way we respond mentally, physically, and emotionally to various conditions, changes, and demands of life and living. Stress can be acute or situational, or it can be ongoing and long-term. Stress can be positive. It can energize us. It can motivate us. And indeed, there's a stress response curve that shows that if we have the appropriate amount of stress, our performance peaks. If we don't have enough stress, our performance is not quite so good. And if our stress level is too high, our performance becomes discombobulated. Unmanaged stress can be detrimental, and especially if it's ongoing. It can decrease our focus. It can decrease our concentration. It increases our anxiety and our frustration level. We can become moody and irritable. We can feel out of control, and we can feel overwhelmed. Chronic stress can be detrimental to our health, and this is stress ongoing for a long period of time. It can damage the cardiovascular system. It can affect the immune response system that we have. And there's now evidence that chronic stress will damage and kill neurons in the hippocampus if ongoing long enough. Well, I'm going to talk just a little bit about that Sunday afternoon stress that we all feel when you all of a sudden think, I've got all of these assignments to do. I have everything coming up, deadlines in front of me, and you just kind of sit there and melt. What do you do? Well, there are a few things that in acute stress, overwhelming stress that you can do. One is remember to take 5 deep breaths. Take belly breaths. As you breathe in, let your abdomen come out. This draws more air down into the lower parts of the lungs and increases oxygenation. 5 deep breaths. Then set a timer for 4 minutes. Close your eyes. Let the sounds and noises and voices in your head calm down. Help them get into order. When you have finished that 4-minute exercise, then think of things that you're grateful for. Now you're ready to look at your the demands of the week. And as you do that, write them out, break each one into smaller groups, and every time you achieve one of those smaller steps, celebrate. No, don't go out for a beer, but celebrate to yourself. Hey, great, I did this. That releases dopamine and helps elevate your mood. So it's a good way to do things. And lastly, remember why you're taking these 10 minutes out to do this. Well, you will be more successful when you take care of yourself. If you are feeling overwhelming and incapacitating stress, that is time to seek outside help. And I would once again refer you to counseling services as well as Lafine. On counseling services website, they have some really good resources, a presentation on stress and management of stress. They also have other resources like some apps that you can use. So do avail yourself of the resources available. The same student that I mentioned, now I'm going to transition. I hate to give more than 9 knowledge points at any lecture. The reason for that is that's all a brain can handle. And I like to talk in triads. And unfortunately, what I'm going to do is try to talk in triads, but I can't quite. The brain remembers things in triads. Brain, sweat, and blood, sweat, and tears was really blood, sweat, toil, and tears, but everybody forgot the toil part. Anyway, moving right along, the same student that gave the opening remarks was a panel member, student panel member, talking to a small group, breakout group of healthcare professionals in college health. And his advice to the healthcare professionals was to allow students to fail, but teach them how to be resilient when this happens. Our lives all have twists and turns, and we have common daily challenges, and we have traumatic events. The American Psychological Association, APA, defines resilience as the process of adapting well in the face of adversity, trauma, threats, or significant sources of stress. And is more than just bouncing back. It is a process of personal growth. Resilience is a learned trait. It takes time and practice to acquire. The APA lists 4 core components: connections, wellness, healthy thinking, and meaning. Learning some or all of these will help you with mental health self-care. So resilience, and as I go through resilience, a lot of these that I mentioned are part of, or are definitely a part of mental health self-care. And I'll summarize at the end and bring things back into a little better focus with, again, fewer than 9 knowledge points. So first step is build connections. Connections help us with our regular mental health. We are a social species. We like to see each other. We like to talk with each other. We like to touch each other. This helps when you're stressed, or not specific to stress, but if you're stressed, if you have anxiety or depression, connections help a lot. First point under connections is it's essential for our mental health. So to work in keeping in touch with friends and family. A little bit difficult with social distancing, but remember phone, FaceTime, and other ways to connect. But also because the weather is still pretty good, you can meet others for coffee, especially outside. And when it's outside, you have a larger volume of air and COVID kind of disperses fairly nicely. You can also go for walks with friends, and I'm going to talk about activity in a little bit, but a walk is a good way to connect with others. And the third point under building connection is join a group. It can be a virtual group. When we're able to get together again, a face-to-face works a lot better, but a virtual group, it could be a social group, a service group, spiritual, or even a professional group. Second point under resilience, as mentioned, is foster wellness. A nurse practitioner friend of mine who has masters both in nursing and psychology is fond of saying, you cannot separate the mind from the body. So taking care of your body helps with stress, depression, and anxiety. First step, get enough sleep. If sleep helps us focus, stay concentrated. During sleep, you're repairing a number of functions, your mental function, but as well, your immune system is repairing during that time. During sleep, you actually solve problems. Remember the old saying, hey, let me sleep on it? Well, studies show that if you sleep on it, your decisions are easier to make, and it also helps solve problems. During deeper stages of sleep, although all are included, you consolidate your memory. So if you don't get into REM sleep beyond 4 hours of sleep, you're not learning quite as well. The second is diet. Avoid mindless eating. Often when I'm nervous or anxious or working on a talk such as this, that I will mindlessly eat. Not a good thing. Also, try to avoid comfort eating. Again, you're getting more calories and not necessarily nutritional calories. Individuals with depression have been known to overeat for comfort or undereat because they just have no desire. Again, if you're in that circumstance, please connect with the people at Lafine or counseling services. And the third thing for physical wellness is to remember to move. Now, CDC says you should do 30 minutes a day for 5 days a week, 150 hours. But beyond that, moving around, especially outdoors, for 10 minutes even, increases your mood, makes you feel better. It helps decrease stress. It helps decrease anxiety. So moving does help, again, especially outside in nature. And you can combine walking with a friend, so there you've got connection, you've got mood elevation, and you've got satisfaction of the CDC. Okay, you're taking care of your body. Now move on to your mind. What can you do? Well, it's recommended by APA to practice mindfulness. Journaling, especially gratitude journaling, practicing yoga, doing spiritual practices. Music might help, and meditation. Mindfulness meditation has been shown to increase the number of neurons in certain nucleus of the brain where our perception stressors and anxiety are modulated. So actually individuals that are having problems with stress and anxiety can benefit by learning meditation. And in a book that I'm reading on meditation is, hey, you don't have to meditate for 20 or 30 minutes. It's good if you can, but if you can do a minute once, 2, 3 times a day, you're doing yourself some service. And the third thing that you should do for your health is avoid negative outlets. Now, alcohol, marijuana, and other drugs might make you feel better, but they just paste over what's going on. It doesn't decrease your problems whatsoever. Alcohol especially decreases neuronal activity, and it masks what we need to be doing, and it interferes with sleep until until alcohol is totally metabolized. So again, getting back to physical health, if you want to be physically well, you need to have adequate sleep. If you drink before bed, you cannot get into those deeper stages of sleep until all the alcohol is metabolized, and we metabolize about an ounce of alcohol per hour. The next subject here is finding purpose. Now, just a slight digression, that purpose and meaning are two different things, but they're actually often interchanged. My purpose is to stamp out disease and pestilence, or it was, but I find meaning from helping others. So I hope you see the distinction there. But as I said, meaning and purpose are often used interchangeably. Well, what can you do? Well, you can help others in finding purpose. Join a group, volunteer. If a friend is in need, you can help them out. And so you're finding purpose. You can also establish long-term and short-term goals. And as you establish these goals, mark how you're moving towards them. This helps you define your purpose. And lastly, it's embracing healthy thoughts. Keep all things in perspective. And be sure to forgive your mistakes. We all make mistakes. Don't dwell on them, acknowledge them, and then move on. Maintain hopeful outlook. Be an optimist, not a pessimist. And the third thing is frame things in a positive light. Yeah, things are really crummy now, and they will get better. Or things are really crummy now, and I can get through it. Not but and it really changes the way you look at things. I'd like to share a short story, and it's not an original. I received it in 2000 in a listserv from Jay Schuyler, who is an endocrinologist, diabetologist in Florida. Again, this is to emphasize the importance of friends. The story, and it's supposed to be a true story. I don't know if it is, but the protagonist is a 9th grader. It's Friday. He's on his way home. Thank goodness it's Friday, etc. He sees a classmate. He doesn't know this classmate because the kid seems to be new. The classmate has 2 armloads of books, and he's wearing glasses. Well, this student isn't the only, the protagonist isn't the only one who sees the student. Some older students, probably sophomore males, because this is typical for sophomore males, come running by and push the kid down. The protagonist sees this very sad look in the kid's eyes, goes over, picks up his glasses, which were 10 feet away, helps him with his books. And as they walk home, they find they have some things in common. So the new kid is invited to play football and hang with the protagonist and his friends during the weekend. Fast forward 4 years, the kid with the glasses is now the valedictorian on his way to Georgetown to be a pre-med student. And he starts off, hey, graduation is a time to express thanks. We thank our teachers, our parents, siblings, possibly a coach, but most of all, we thank our friends. And then he went into a story that was very self-revealing. You see, the day that he was walking home with all of his books, he had decided to commit suicide that weekend. And he had cleaned out his locker so his mother wouldn't have to. And as he picks up his narrative, and he said, And I was prevented from doing this unthinkable thing by a friend. And you notice that the protagonist was not a friend at that point. He was just somebody walking by. The meaning from this that I hope you get is that connections are very important, even new connections. So reach out to individuals in your group, in your lab, in your courses that seems to be isolated or alone, or even those that just seem struggling. Just reaching out can be very helpful and meaningful in a long-term manner. Okay, now reaching back, I'm going to reduce the resilience to 5 points for mental health, stolen from another source totally. But the first that is on their list is be positive and have a positive outlook. 2, reduce stress through the things that we talked about: activity, good diet, good sleep, connections, putting things into perspective. 3, be sure to get sleep. 4, keep those connections going, and being mindful. Okay, thank you very much for your attention. My talk time, we had decided would be 20 to 25 minutes, and I think I'm just right there for you. And we do have some questions that were pre-submitted, and Dr. Wallace will be presenting those so that you know what they are, and I'll respond to them. So thank you.
Okay, let's just start by thanking Dr. James. You can use your clap reaction or unmute if you like, but I thought that was just wonderful. I especially love that story you told.
Thank you.
Okay, so let me just introduce the question part and how this is going to work. So we have, as Dr. Guess introduced, some pre-submitted questions, and I'll use those to kind of fill any dead space, but anybody here live can also present questions in one of 2 ways. You can either unmute yourself and speak, I guess 3 ways. You can unmute yourself and speak, you can put it in the chat, or if you want to remain anonymous, you can just send me privately your question through the chat, and I'll read it as though it was a pre-submitted one, and we won't share any information that way. I do also want to point out that there are some people who aren't using identifying information in the Zoom meeting. So for those people, we're just going to, for those people's sake, anybody that asks a question, we're just going to avoid names of all kinds and move forward that way. Okay, so with that, our first pre-submitted question was actually just a comment. It was that undergrads right now are also under a lot of stress from isolation, this and quarantine, and we targeted this event towards graduate students, but I wonder if Dr. James, you could speak on how universal the themes were that you presented today.
They are a lot more universal, and I should have emphasized this more. I had just Googled yesterday on COVID and depression, and University of Minnesota, University of Michigan, and others have done questionnaires and others, and have found that the incidence or the prevalence of depressive symptoms has tripled in adults from low teens to almost 30%. So that, yeah, it's very significant, not only to the college age, but to adults all over. As I mentioned earlier, we are social animals, social creatures. We really need that contact back and forth. We have, yeah, as I mentioned, I'm older, and my wife is older, and between us, we have more risk factors than we have fingers, so that we try to be very careful. But during, I know I warned you very early that I will digress. Very early in our, well, just about 4 years ago, I've been in a very stressful situation. Before that, there was work stress, but then a home stress problem that has been ongoing. And one of the things that helped me get through was meeting a former student on Fridays when I got back to town. I worked in Manhattan and drove to Lincoln on Fridays, then meeting with another couple for dinner while my wife was recuperating. And they, for the last 3 years until March, we kept up that tradition. And meeting with them on a regular basis was really, really helpful. And now that we can't do that, I really feel not so much the isolation, but the isolation, yeah, I'm alone. But I really miss that physical face-to-face contact. So it affects not only college age, it's affecting all of us. We all feel for this being isolated, and finding ways to reach out through phone calls, through FaceTime, et cetera, is really, really important. And maybe, like I said, if you can go for a walk with someone, if you can meet them for coffee and eat out and drink it outside, risk of spreading is a lot less. So try to keep contact with your friends and peers.
That's fantastic. Dr. Guest, we've had a couple of questions come in through private chat. I'm going to share the first one. It's again a comment. It's a concern about something that you said earlier about the negative effects that can come from eating as a result of depression. And this person was concerned that shaming somebody for eating to deal with their emotions might not be helpful, and it might actually lead to eating disorders. And they go on to suggest that getting help and support for depression should be your primary concern, and maybe kind of you deal with any other secondary effects later. Would you like to address that?
Oh, just very briefly. The comment is absolutely correct. Don't want to shame anybody for eating. It's just an eating behavior that is noted. And seeking help is really important. So it's the individual that I mentioned without, hopefully, maybe someone took it wrong, that one of the symptoms of clinical depression feeling, there are a number of symptoms, but lasting for weeks to months and interfering with daily activity. Those are concerns from a nutritional standpoint and long-term health standpoint. So they're absolutely correct. The main thing to do is get clinical help. And if there is an issue with eating that the individual has, yes, that is secondary. It's more of a symptom, overeating and undereating, or both symptoms. But also, as we know, this just came out more recently in the last couple of weeks. Congratulations, Kansas. Your BMI is, for adults, 35% are obese, overweight and obese. So it is also long-term health problems. So separating mental and physical are not always all that easy, but I'm glad the person pointed out that, yes, first thing you need to do is help with whatever depression or symptoms are going on, and then address the health concerns with that. So I'm sorry if I offended anyone with that.
Okay. So let's move on to the next question. So we have another chat question that asked if you have suggestions for connecting with people if you have social anxiety. You kind of really highlighted in your talk about how important it is to make these connections, but what about those of us that are anxious socially and struggle to do that?
This I really appreciate. In my original outline of my original talk, I do have a great degree of social anxiety, and I can date it back to high school, where it would take me 3 or 4 days beyond what probably was normal to give a call to either try to make a date or to call a friend to see if they wanted to do anything. And of course, you dial. This is way back with rotary phones before answering machines. And then I would get a busy signal. Totally defeating. So yeah, connecting with others. And that's where the social anxiety is. When I told a story about reaching out, it's a good time for individuals to reach out. And if you're having problems with social anxiety, I really would encourage a visit over to counseling services. They have some suggestions and way to get around this, not so much get around this, but to address it. And if you're using cognitive behavioral therapy, it's addressing it in small manners. Right now, during this time, it's really good. And for me, I found that online is a little bit less stressful than in person. But one, if you notice someone who's having problems with social anxiety, or it seems to be withdrawn, you're not going to make that diagnosis. But if they're having social anxiety, kind of reach out to them. Individuals really appreciate that are anxious, and it grows with time, and with familiarity, it's not as bad. Thanks very much for that question. I really appreciate it.
That was a great answer and some great pointers for us. We have another question from the chat. This one says that you mentioned, sorry, I'm getting too many and it's scrolling down, that you mentioned meditation, purpose, and meaning. And this person is wondering if there's an overarching way of being or useful belief to start with as you navigate school and mental health issues and work. Is there any kind of overall perspective that we could use to try and maintain ourselves?
I would say yes. And this is, again, a personal perspective. One of my best friends was Epictetus, who was a Stoic philosopher, former slave, about 2,300 years ago. Anyway, what he said, and has been quoted many times, is you cannot control what happens to you. You can only control how you respond. So I think that's the overall overarching. You can control what you do, not what happens to you.
Okay, so that was just kind of what you're saying there, is to make sure that you're giving, you had this example of the and. I really liked it during your talk. You said, this bad thing happened and I'm going to be okay. And
Right.
kind of making sure that we're not letting those outside events take control of our lives, but we're still like kind of ourselves empowerment to.
Yeah, that and the conjunction using and instead of but is very important, because if I'm telling you, oh, yeah, you're anxious, but you can get over it, it's much different than saying, I know you're having problems and you can get over it. The difference between but and is but may say, I'm negating your feelings. Whereas Anne says, hey, yeah, you have these feelings, and I know you've got the strength to get through it. And you can also throw in, and I can help you, and I'm willing to help you if possible.
That's great. Okay, we've got several more coming in here. Let me see. Next up, we have, do you have advice on how to approach or talk to someone who you think is dealing with a mental health issue without offending them or harming them? What if I'm worried about a colleague? I don't want to make them feel bad by saying, hey, I think you're struggling. How should we reach out to others?
Well, basically, again, you can find, again, online, some scripts and other things. ASU, Arizona State University, wellness, asu.edu, they have depression little button, and how to help a friend. But basically, what you're doing is going up and asking, how are things going? Or even commenting, hey, you look a little down or seem to be acting a little down. What's going on? So just being non-judgmental and reflecting what you see and allowing the other person to fill in what they want to.
Right. So trying not to jump to judgment, but be there as a friend is kind of the idea. So at this point, I want to take one of the pre-recorded questions or pre-submitted questions. And I do want to point out that if you follow us on Twitter at selfcare@KSU, I'll put this into the chat. We're going to be sharing throughout the year the resources that Dr. Guest has been providing. So we'll try and continue to make those available throughout the year in case, maybe you don't need them right now, but you need them in March or when it gets dark and gloomy in January. I know I hate cold weather. Okay, the second submitted question was, how much of our academic success should we be willing to sacrifice in order to prioritize our well-being? How much should we give away to get this healthiness that you're talking about?
Perfect question, because as I read this, this is a false dichotomy. It's not either being academically successful or mentally well, or personal well-being. It's that and. Way back, way back before anybody here was born, except me, Ernest Boyer was the first commissioner of education for the United States. This was in the early 60s in the Johnson administration. And what he said is wellness is a prerequisite for all else. Students cannot be intellectually proficient if they are physically or psychologically unwell. So if you want to be successful academically, you've got to take care of yourself, both physically and mentally. This was also recognized, and I've used this in many presentations of Herophilus of Chalcedon, father of anatomy, also physician to Alexander the Great. But basically said when health is absent, intelligence cannot be applied. So you've got to take care of yourself. So it's not an either and, it's figuring out how to bring them both into play. There is also a newsletter out of Washington State University, emergency room physician talking about balanced life. He said, yeah, I have a balanced life, but on any given day, given any week, something is going to take predominance over that. So everything is not going to be in balance on a given day, but overall they will be. But basically, it's not a, getting back to the original question, academic success and well-being are not separate. They're not on the same pole. You got to take care of yourself, and then you will be more academically successful.
That's a beautiful thing to remind all of us, especially professors. I mean, we as professors, I mean everybody, but as a professor, we often forget that our students and our mentees' well-being is just as important as them being in the lab. Not just as important, but directly tied to, and we can't separate them. So as a mentor, thanks for that reminder of, it's just as important to go out and enjoy a beautiful day as it is to pipette that day, because sometimes one is dependent on the other and you can't have one without the other. Okay, let's see. I got a third question for you, Dr. James, our third submitted one. How can I manage my time between studies, research, and other activities? Sometimes it just feels like we are completely overwhelmed with stuff, and when I hear advice on how to maintain my mental health, I have to be honest with you, my first reaction is to almost panic. And I take a deep breath and I say, I can barely manage what I'm doing. How can I do more? Can you give us some advice on managing time between all of these things?
No, but yes, you just have to make priorities. And there are a couple of things within here that you said. One is take some breaks during the day. There is some psychological and neuroscience evidence that if you're working on a problem and intense or run into a problem that you're having solving, walk for 10 minutes within the building. It kind of helps clear the brain, gets things back in order, reduces that absolute concentration if you can do it. And the other that has been shown is taking 10 minutes out in nature. And Kansas State University campus is a great place for this. You've got lots of trees, great flowers, enough squirrels to watch and enjoy. But just being out there, take your earbuds out. That is going to defeat the purpose. What you want to do is hear nature as well as see it. And it does help elevate the mood. So yeah, putting things, prioritizing. Maybe another, and this is just totally different. It did run into my trying to make the presentation. Atul Gawande is a surgeon and a columnist and a number of other things. Wrote a couple of books. He also is uh, instrumental in writing a checklist for operating rooms, reducing mortality throughout the world for WHO. But he wrote a book called Being Mortal. His main question in there, as he's was experiencing end of life experiences, is can you answer this question? What is a good day for you? And you can be very flippant, first answer, but then think about it. One of our administrative assistants at the health center, when presented with that, I cannot answer that. And 2 weeks later, I'm still working on that. One of mine, and I'll share this with you, is mine is to have time to read for pleasure at the end of the day. But in order to do that, when I was working, now I have to reorder I'm in that existential crisis. I used to be somebody, and now I'm just a caregiver. Having time at the end of the day to read meant that I had to get my meetings done in the morning. I had to finish lunch. I had to be back, get my clinic started in the afternoon. Things couldn't spill over. I had to have time to do my 30 minutes of exercise, eat supper, clean the apartment, and then, if I was lucky, there was time to read. But it was a good day when I could do that. So I'd order my day so that I could do that. So ask yourself, what is a good day for you?
I absolutely do not have an answer to that.
It is really, really difficult. And in fact, one of the answers in the book was a man was dying of terminal cancer, and Atul actually thought that he had answered to have more time with my family, but he said no, it was time to have time to read, because he still enjoyed reading and thoughts and ideas. And he did have lots of time with his family. He didn't feel that he needed more, but he needed time for thoughts.
Let me move on to the fourth question. The fourth submitted question was asking you if you had any tips for compartmentalizing life. I think, well, that's really all it says, and I don't want to read into their answer any, so I'll just leave it there for you.
I have not looked into that whatsoever, but I am a tightly compartmentalized person, and I developed that. I have no idea at what point in my life. My practice life was different from my home life, and I didn't let the two jump one into the other. My profession, although it's part of my identity, it was not my sole identity. Yeah, when I was on call, I was on call answering phones throughout the night. But that didn't run into some of the other things. So yeah, being compartmentalized is difficult. I have not looked into how a person does that. It just happened somewhat naturally. And I do put different things into the compartments and don't let them overlap. My father was an accountant, and he was used to thinking in lines and columns, and maybe that's where I developed that. I'm not sure, but yeah, when you're finished with work, try to walk home and try to enjoy what's going on. Maybe it's that, take the earbuds out and walk to your car and enjoy what's going on out there in nature.
It sounds like there's some common themes to those two answers. The one on managing time and compartmentalizing. I was noticing that you had a theme of make sure that you have a reward and a thing to enjoy in the day, so that it's not just, you know, I've got to study and I've got to research, but it's also like, if I study proficiently and if I do my research proficiently, then I will have time for this thing that re-energizes and makes me feel whole again.
I think that's fair.
Okay, let's see. I have a fifth question for you. That was, okay, this one's good, I think. they're wondering if you can give them 2 to 3 lifestyle aspects, so things about our lifestyles that are most critical for maintaining and achieving good mental health.
I do, and the list could go on for more than 3, but if you wanted just 2 or 3, first, maintain connections. I think I've emphasized that enough. I'll throw another one in connections and being that friend. And it's again from Sherwin Newland's book on how we die. The book was written in dyad, scientific, about a cause of death, and then A Human Story talked about AIDS. And again, the book was published in 1991. If you were a gay male or had AIDS, you were ostracized from your family very often, not always. So who took care of you as you were dying? It was your friends and your community. It was the caring surround. So again, this again emphasizes the importance of connections. So keep connections going. So that's my number one. Second is sleep. The old saying, well, I'll sleep when I die. And the answer is, oh, yes, you may rest when you do that, but you're going to die sooner if you don't get enough sleep. And that is proven scientifically. So get your rest. It'll make life a lot more enjoyable. And 3, move. You don't have to be a marathon runner. Get out there walking in nature, bicycling, jumping rope, doing yard work. There's all kinds of things, all kinds of ways to be active, but do move because it does elevate your mood, and it decreases stress. It helps you decrease anxiety. It's that triad, I think, would be the most helpful for all of us.
Okay, so that was connections, move, and sleep, right?
Right.
Fantastic. Let me ask a follow-up. This isn't on one of the pre-registered questions, so I'm going to throw you a curveball. COVID makes some particular challenges to this for anybody who's gets a positive diagnosis, or even while you're waiting for a test. It's a very stressful time. You're asked to isolate, which removes some of those connections. Do you have any particular advice for those people right now who may be needing a test, maybe even have tested positive? How do we maintain connections in an environment where, for the health of the community, we're asked to isolate?
Obviously, it should not be person-to-person connections, but use the telephone, use the internet to do some face-to-face electronically, getting along, and don't hesitate to contact others. I think that's where I would put that. The other is the anxiety thing, and this is where mindfulness and the deep belly, I talked about acute stress, those belly breaths, or beginning to meditate even for a minute, just concentrating on the air going into your nose or into your belly or wherever it's going, really helps calm you down. It helps pull things into perspective. I was amazed. I'm not good at this stuff. Just started in the spring. Do my 3 minutes a day, that's really good. But doing those self-care, the mindfulness, and saying, hey, yeah, this is COVID. I happen to be a college student, puts me in low risk. 80% of look at the statistics, 80% of individuals have no or mild symptoms. Most individuals in the age group that we're talking to, grad students and under, the morbidity, mortality rate are really low. So it's very true to say, yeah, I'm being investigated for COVID or have COVID, and I can get through this. And keep in touch with your medical provider, keep in touch with your family, keep in touch with your friends, keep in touch with your instructors. If you really don't like your instructor, go into his office without your mask on, cough a few times, run away. But realistically speaking, yes. As I mentioned very early, we thrive on, as a species, we thrive on contact. It releases dopamine and oxytocin when we touch each other. Hey, so it's very difficult on us. Try to do the substitute by using electronic means of communication.
Okay, we had a question come in through the chat during this, and this is actually one that's pretty close to my heart as a first-gen. This person is a graduate student, and they sometimes feel it's hard to feel like they're part of the community. At school, everybody does their own research, and outside of school, it feels like they don't get to give back to the world because they're too busy working on their degree as it is. They're wondering if you have any tips on finding ways or developing a sense of belonging in a new atmosphere, in the academic atmosphere.
Yes, I am glad you brought that up. Early on, I mentioned joining a group. And if you're new to university community or whatever, it really helps. Look at interest groups. Right now, there are still some virtual groups that you can belong to. And as restrictions decrease over the next 12 months, do reach out to other groups. Now, if you are in a lab or classes where you run into other grad students, try to do some small group connecting with that, because that's still legal. You can, there was a nice story in Wall Street Journal about freshmen trying to get the freshman experience. Yeah, there were 5, 6 freshmen playing poker. They had a table. Everybody was 6 feet away from everybody else. They had masks on. When they went to place a bet, they walked up to the table, laid it down, walk back to the chair, which is farther away, etc., so that you can do the social distancing thing. The main thing, I think, is more in the confinement. Try to avoid confined spaces. I think that's going to be very important. But yes, it's difficult right now. Look for virtual groups. Look for individuals that are in your area of study just to say hi to. And you never can tell what will develop just by that reaching out.
That's right. I have to say also that I have been really impressed with how creative people have gotten with maintaining their connections while keeping social distancing. I've seen all sorts of creative strategies where people are, it's like your poker strategy, where people are finding ways to get similar experiences to what they miss without putting themselves at risk. So don't feel like because it's COVID, you have everything restricted to you. You can get pretty creative out there. Okay, let me see. I've got another question for you. This one is a pre-submitted question, and it says, what do you do when mental illness makes your progress through grad school slower than it seems it should be? This person feels like they're far behind their peers, and that's just making them feel discouraged.
Yeah, that is a good question. I think I would take a step back. If they think that their mental illness, if they have a diagnosis, it might be to talk to your provider, either your psychologist, counselor, or your medical provider. Maybe there are steps that need to be optimized to help out. So I think that's where I'd start is whoever is helping with you, helping you with your mental illness, is to see if things are optimized and do they have ways to improve them. Specifically, I can't respond because I don't know what's going on with you as an individual. But I think that the other thing is acknowledging and accepting, yes, there are times when my mental illness, it might be anxiety, it might be depression, makes it hard for me to work. Is my treatment optimized? But if not, to accept that. Okay, I know this is going to happen, and I know that I can get through this. It might take me a little more time, but I can do this. I can persevere. Obviously, being a little home a little too often or too much. I never used to watch movies. We watched, now I've forgotten, but it was a very nice walking meditation. And again, this is an affirmation, is just kind of walking from car to office and reciting with each step, we are the champions, we are the champions. Not necessarily to be encouraging, but to say, hey, yeah, I'm going to get through this. We're in this bad spot. And yeah, my mental health for this individual, but we are the champions. I am going to get through this. I'm going to have to persevere. I can do it. I'm going to reach out and try to get some more help. But the affirmation is, this is what I want to do. It's not so much a mantra as an affirmation of what you want to happen.
Absolutely. Just as a mentor, I would add to that that sometimes graduate students feel like their success in grad school is measured temporally. How fast do I finish school? How fast do I get that degree? And I would argue that that's perhaps the worst metric you could have of a success in grad school. The point of going to grad school is to learn and to gain skills so that you're prepared for the next phase of life. And would you rather have less skills and get your degree in 5 years, or be more prepared to do the things that you came to grad school to learn to do and maybe take an extra year? So getting back to something Dr. Guest said early on of forgive yourself and be encouraging of yourself. If you're taking longer than you think, maybe that's not actually that bad of a deal. I graduated earlier than one of my peers. He took a long time and was super frustrated. But then he ended up getting a high tier paper out of his frustration because he took a little bit longer and he didn't rush through things. So I don't think that time is as big of a deal as you might think it is.
Again, he's long since retired and probably dead. Sidney Harris was a commentator, wrote in the paper, but he mentioned in the Greek Olympics, and I have not been able to find this, there was a race where the runners ran with torches, and the winner wasn't the one who crossed the finish line first, but the one who who crossed the finish line with his torch lit. So that's kind of what it's not how fast you get through, but can you keep your torch going?
Yeah. Well, what can you accomplish along the way?
Yeah.
Okay, we're about to run out of time. I've got one last question for you. This one says, I'm working very hard to remain engaged in one of my classes, but I'm struggling because I don't feel like I'm understood by the teaching team. What mindsets or approaches would you suggest to letting go of being upset about something I can't change? So that last part is pretty universal. When we have things that we can't change that are keeping us from succeeding, how do we get by that?
Well, I think that goes back to the Epictetus statement. You can't control what happens to you, only your response. So the individual is very much right on this, or he or she is right in line with what they should be doing. It's okay, recognizing, hey, I can't control this, but how am I supposed to respond to this? It's okay, let's let it go. And not get upset about it because it just doesn't matter.
Well, that is really the bulk of our submitted questions. We've got about 2 more minutes. There was one last comment that was submitted that asked, what does a social media campaign entail? And I thought that I would just say that if you haven't seen us on Twitter, what it entails is when people gave us permission to share their stories and encouraging statements, that we've tried to make the Twitter page to be a resource where people can tune in and see that the problems that you might be dealing with are common, that they're shared by people who maybe you look up to and think, oh, that person never struggles. So that's really the answer to that person's question, is that we just wanted to create an online resource for anybody who might need it to hear that other people struggle, or might need to hear from somebody, hey, if you need something, come to me. So that's what our social media campaign entailed. Like I mentioned earlier, Dr. Guest has shared some resources with the group of folks planning this, and so we're gonna keep sharing those. And the last thing I wanna do is just to acknowledge everybody who's worked on this and it's helped. We've had Dr. James doing a wonderful job today and throughout the planning. We've had the Graduate Student Council, Priscilla, Sam Sharp, Mark Ungerer, Miki Tobler, Allison, I keep thinking, Kyle Gruhl. There's just been a huge group behind this. James Parker at Lafine. It's been a lot of people working on this, and I'm very thankful for everybody's contribution. And I just want to thank you, Dr. James, for your time. It's been nice. Thanks everybody for joining us. Thanks everybody who participated in the Qualtrics survey. You really fueled this event. All right.
Okay, thank you.
Thank you. That was wonderful.